going to puppets, the younger generation from age 18 to 26, this has often been recorded on a higher range in terms of percentage. You were telling last time the percentage also. This has been some of our HR community also, we got to know that this is getting rapidly onto the younger generation as well. Now, we go in multi-basis. It's like prevention is better than cure. So the vaccination is only source for that. So Mr. Ram, if you can just give a highlight on the process of the vaccination.
So I'm also like a techie guy. We also work with some kind of Fortune 500 companies. And I started my own company named VGrow as a private limited company, and we used to do the complete end-to-end customization. End of the day, student also feels shy, employees also feel shy, right? They can't come and they can't openly say like. So we had given them the direct contact of the Apollo. So they went individually. And there was some kind of people, like around 38 people went for PAP, and there was some kind of count they got positive. We don't know who are those, but generally what of the report we got, like there was some kind of count they got a positive. So immediately, coming back as going somewhere about the vaccinations is like, please go and take the vaccination. Please do that. Not only girl, boy and girl should take this vaccination, so that there is till 26 years, it is a free to go. There is no problem about it. After 26 years, based on your age, any fever, any some kind of complication like sugar, BP, then the doctor will take the consultation and then do that. Till 38 years, you can take the vaccine. There is nothing wrong in that. And apart from that, the vaccination cost is like market. MRP is around 4,000 and above. Consultancy charges of the doctor may be around 500, 400 based on the portfolio of the doctor. Altogether, it is around 4,800, 5,000. But as a VGrow, along with the consulting charges, we are sponsoring for 2,000 rupees. So you can get registered here, and based on the registrations, doctor will come again on one fun day. Monthly, one Friday is a fun day for you. So we can spend one half of the day of the fun day, so that we can bring the doctor and vaccination to your doorstep at the corporate, and we can see that the vaccinations are done. So this is the part of the process of the vaccination. So you can Google it, you can see that you can have awareness on this particular part, then get educated on this and get rolling out.
So are we tied up with some Apollo hospital, or is this?
We have tied up with 3 hospitals, one is Apollo, Cave and Rainbow, and Star we are able to, still we are in the progress of tying up, and we are also talking with other hospitals also like Keeps and other hospitals also. So end of the day, all doctors they are coming for us to do on a social cause. There is nothing like that we are paid for them, but they are coming on a social cause for us, and they are also putting their contribution towards our foundation, so that they can also put some kind of social kind of element. So out of their busy schedule, they are coming out and they are giving the talk here.
And infertility specialist as well, with overall 20 plus years of consultancy specialist. Currently, she's been associated with the Care Hospital and other 2-3 hospitals as well.
So we have got a cervical cancer vaccination. So how many have you taken vaccine here? Girls? None. No idea, or you not getting time? Lack of knowledge. Shall be going to so many, I do go to so many colleges, schools, everywhere, wherever, even in spite of government giving so much of education regarding that, I feel very less people have taken cervical cancer vaccinations, basically lack of awareness, and those who are already having awareness, they don't have time. That is the problem. So this cervical cancer can be prevented. We have vaccination available for girls as well as boys also. So vaccination can be done from the age of 9 years to, here it is written as 26, latest guidelines say up to 45 years. So from 9 years age group girls till up to 45 years of age group, they can take this cervical cancer vaccine, and they have to take this cervical cancer vaccine. It is better that the girls or boys take this vaccine before going into the sexual relationship, because the action will be more, the effectiveness will be more. And even after taking vaccination, still you have to get a regular pap smear test done after the age of 25 years old, and using safe sexual practices and avoiding smoking, they help in prevention. So we have different kinds of vaccinations available in the market, like Cervarix, Gardasil and Gardasil 9. This Cervarix covers only 3 kinds of viruses. Nowadays we are not giving the Cervarix, we are giving Gardasil and Gardasil 9. This Gardasil is available from the past 15 years in India. Gardasil 9 is recently introduced during COVID times, just 2 or 3 years. So Gardasil plain, it acts against 4 kinds of viruses, deadly viruses which call cervical cancer. whereas 9 acts against 9 kinds of viruses. So the age group who have to take this is starting from 9 years, we have already spoke. So before 15 years, if the girl is from 9 years to 15 years, they need only 2 doses. If they are taking the first dose now, the second dose will be given after 6 months. But once a girl crosses 15 years of age group, then they need to take 3 doses. The first dose, if they are taking now, second dose is after 2 months, third dose is after 6 months. Gardasil 9 is advised, the latest consensus we have to give to males also for the prevention of anal and penile cancers. Same age group, 9 years to 25 years age group. If they are under 15 years, then 2 doses. If they are over 15 years, it is 3 doses. So it not only protects against cervical cancer, it also acts against genital warts, vulval cancer and vaginal cancers also. So the cost factor plays a main role. Cost of Gardasil 10 is around 3,500 and Gardasil 9 costs around 9,000. So don't look into the cost, look into how much it is covering. So Gardasil 9 is the best one because it is acting more number of viruses. And recently, the government of India has also introduced a vaccine, Cervical, which has to come into field. It was just announced in the last budget that they will give free cervical cancer to the government hospitals, but still not in come into act. So this is the vaccine, Cervical. And there are no side effects with this vaccine, nothing. We know COVID vaccine has got so many complications after so many years. We got embolism, heart attacks, and all, but this cancer is safe. It is Gardasil is being given in India for 15 years. No major complications till now, nothing. No fever, nothing, no minor or major. So these are the stages. Next comes breast cancer awareness. Nowadays, we are seeing more breast cancer and cervical cancer women among all other cancers in the female reproductive system. So, it can occur in any part of the body cells which can grow uncontrollably, and the common age group of this breast cancer is 45 to 49 years of age group. So, what are the risk factors which females are more prone? Are mainly age. So, we spoke about cervical cancer, younger age group people are most affected, but in breast cancer, mostly breast cancers usually occur after the age of 50, but still young people do get breast cancer, but the most common incidence is after the age of 50 years. Those who have genetically inherited mutations, those who have family history of breast cancer, ovarian cancer, they are also more prone at a high risk of this breast cancer. And women who have achieved early menarche before the age of 12 years and who have late menopause because of continuous exposure to the hormone estrogen, they are also more prone for this breast cancer. Personal history and family history of breast and ovarian cancer. Any previous radiation treatment, too much exposure to radiation also can cause breast cancer. Even males also can get breast cancer. 4% incidence is just 4 in 1 lakh. So even males can also get breast cancer. So what are the warning signs? How do you know that your breast is something abnormal? Then you have to go to a doctor. What should be there? So if you are feeling any new lump in your breast or underarm, it is not a good sign. So it is important that you visit your doctor, get yourself checked and get all necessary investigations done. So any thickening or swelling and any part of the breast, suppose your skin is thickened, your skin is looking not normal, you feel some problem, then it is a time that you get yourself checked. Any irritation or dinting of the breast skin, any redness or flaky skin in the nipple area or the breast, pulling in of the nipple. Normally it is pulled out, but sometimes if a normal nipple, if it goes inside retracted, then it is an indication that some problem is there. Any pain in the nipple area. Normally also women have pain in breast during periods. Don't take that into account. In general times, if you are facing any excessive pain or feeling some problem in the breast, then it's the time that you get yourself checked. Any kind of nipple discharges other than breast milk, like any greenish discharge, watery discharge, bloody discharge from the nipple. If you are not breastfeeding, then it is a symptom that some problem is there. Any change in the size or shape of the breast and any pain in any area of the breast, these are the warning signs that you should get yourself checked. Lump, pulling nipple, skin changes, redness, rash, dripping and dimpling. So these are the warning signs. So how to reduce the risk? The obesity is one of the risk factor for this breast cancer. So maintaining a healthy weight, being physically active, and choose not to drink too much of alcohol or in moderation, avoiding smoking. And for women, do those who breastfeed their child, the risk of breast cancer is less. So please try to encourage breastfeeding so that the cancer risk is very less. And if you're already having a family history of breast cancer, then it is a time that you get evaluated regularly, checked up regularly with an ultrasound or mammogram, and talk to your doctor if any necessary genetic investigations are to be done to detect it at earliest. So we have a lot of screening methods to detect breast cancer, like physical examination with your doctor, ultrasound screening, and mammogram or MRI. So like how we have screening test for cervical cancer, pap smear is a screening test. We have screening for breast cancer also, general breast examination. Ultrasound is advised for women below the age of 40 years. Once a woman crosses 40 years of age group, then they have to go get a mammogram done. So lots of hospitals have this packages, health packages, which include this pap smear and mammogram also. So it's a part of health package for women. So one more thing is like how pap smear, self-breast examination is very, very important to detect the changes in the breast. So every woman picks a day in a month for yourself to check your breast. So better to avoid during menses because the breasts are tender during periods time. So other time, try to look yourself neat in a mirror and see how your normal breasts look like, and check any variation in the size or any skin dimpling is there, any skin changes are there, you're feeling any lumps or anything. If you notice any change in your organ, then it is a time that you get an evaluation done. Ultrasound, usually routine ultrasound detects breast cancer, but the most sensitive thing is mammogram, which detects with more sensitivity, and who have to be screened for breast cancer are this routinely women between the age of 40 to 44. They have the option to start screening with mammogram every year, and women between 45 to 54 should get mammograms every year, and women 55 and older can switch to mammogram every year, and they can choose to continue yearly mammograms. If consecutive 5 mammograms are normal, then you can defer this mammogram and go in for a regular ultrasound scan check. So what we do in the mammogram is we take an X-ray to see if there is any visible lumps or any calcifications are there, any lymph nodes are enlarged, any skin changes are there, any asymmetry is there in the breast or not. So if you have a family history of cancer, then self-breast examination screening for normal people will start at the age of 30. For the women who already have a history of breast or ovarian cancer, the screening should start at the age of 30 years, and breast MRI mammogram to be done early and should be in regular follow-up with your doctors. And there is no association has been identified with the use of silicone implants and occurrence of breast cancer or any autoimmune or connective tissue diseases. Self-examination is important and recommends regular follow-ups and screening by surgeon depending on the implants. So negligence costs your life. So all of you, please, I advise all of you to go ahead with the cervical cancer vaccination. Not only you, please advise your family members, whoever are there, your neighbors, friends, to take this cervical cancer. It's very easily available anywhere in the hospitals, so that you can prevent this deadly disease of cervical cancer. And regular health checkups, fast health checkup, get yourself checked, get an ultrasound, and a breast ultrasound or mammogram is mandatory for all of you. Thank you.
Guys, people still have any questions left? Or you might get questions once the ma'am is out of this, right?
Because it's one session actually covered important ones.
Major thing is that amongst these two, these symptoms are mainly confused with the periodical changes or menstrual changes in the women. So we might not be able to identify that ourselves, or we will still not be aware. We might still think we are energetic and we are healthy and we are evergreen. But these symptoms will not just knock your door and say, hey, I'm inside. Right? It's always better to prevent rather than taking action when it is too late to take, isn't it? It is not just for you; it is for the entire family, right? Even men out there might be thinking, this might not impact me. No, you are still going to be victim here, isn't it? So be careful, guys. Everybody go with this. Take as much as knowledge you can and approach us. We are there to help you with you and your family. It's not just going to spare one life. It's going to make your happy family. Man, thanks a lot. You made a lot of time from your schedule, and it is Monday.
Yeah.
So you're on demand always. Thanks a lot.
So to your busy schedule came.